Hello viewers, I'm Zahoor Islam and you are watching me on my YouTube channel Zahoor Islam Official. Uh, let's talk about emulsion. So emulsion can be defined as this is a biphasic liquid preparation containing two immiscible liquids, one of which is dispersed as a minute globules and two another's. And pharmaceutics emulsion is a biphasic liquid preparation which generally contains two immiscible liquids. Immiscible liquids are those liquids which are not mixed with one another. So as a result of when they are dispersed, as a result of globules, minute globules, they are formed and into the other. Now the liquid which is converted into minute globule that is called dispersed phase, and the liquid in which the globules are dispersed is called continuous phase. So emulsion is a two-phase system. Emulsion, it may be oil and water type of emulsion or water and oil type of emulsion. So in first case, in oil and water type of emulsion, oil is the internal phase and water is the external phase. So one is the continuous phase and the second one is discontinuous phase. So we are going to disperse the oil and the water. So oil will be in low concentration and water will be any higher concentration. So in this case, in emulsion, pharmaceutically, this is the unstable system and which the liquid which is converted into the minute globules that is called disperse phase. One is disperse phase and one is dispersion medium. So actually the phase which is dispersed, for example, oil and water as a used as a dispersion medium. So normally the two immiscible liquids it cannot be dispersed for a longer period of time. When two immiscible liquids it cannot be dispersed for a long period of time. So there are certain reasons. So by adding the emulsifying agent is added to the system. For example, when we are going to mix two liquids and they are not going to mix, for example, oil and water for a longer period of time, then what you will do, so you will add some emulsifying agents and that emulsifying agent will be added to the system, and then it will form a film. It will form a film around the globules in order to scatter them independently in the continuous phase, so that a stable emulsion is formed. Now, F2 liquids they do not mix by the addition of emulsifying agent. Both the liquids they will start mixing, and there will be stable emulsion will be formed. Now come towards the types of emulsion. So there are four major types of emulsion, but here we will discuss about the two different type of emulsions. The first one is oil and water type of emulsion. So what is oil and water type of emulsion? It is that type of emulsion which we have already discussed, that emulsion in which the oil is the dispersed phase, whereas water is the continuous phase. I mean that oil is the discontinuous phase. An oil and water type of emulsion, they are preferred for internal use. As usually, the emulsions which are used for internal purpose, for internal use, that is oil and water type of emulsion. And these emulsions, the gums, echinacea, Tragacanth, methylcellulose, saponin, synthetic substance, and soaps. They are formed from the monovalent bases like sodium, like potassium, and they are used as a emulsifying agents. So I mean that an oil and water type of emulsion, the oil is the internal phase and the water is the external phase. So we are going to disperse the oil and the water. So water is in higher concentration. So higher water is the continuous phase and oil is the discontinuous phase. While in the second case, so water is oil and water is oil type of emulsion. So emulsion and with the water as in the dispersed phase, where oil is the continuous phase. For examples, the waxes, resins, beeswax, and soaps formed from the divalent bases like calcium, like magnesium and zinc. So they are used as the emulsifying agents. So as usually the water and oil type of emulsion, they are mainly used externally. For example, lotions and creams. So lotion, creams, all oil and water type of emulsion, water and oil type of emulsion. So creams are water and oil type of emulsion as well as the lotion because they are as usually they are used for the external purpose. The third one is intravenous emulsion. So intravenous emulsion is that type of emulsion. These are actually the oil soluble hormones. Intravenous emulsions are the oil soluble hormone, and these hormones can be in the form of this vitamin A, for example, retinol, cholecalciferol, and vitamin K. They can be they are administered as intravenous injections. So the oil soluble hormones like vitamin A, vitamin D, and vitamin K, they are administered as intravenous injection. So the emulsified oils, they are also injected as a diagnostic aids, and the emulsion should have small globule size and must be sterile and must be free from pyrogen, free from microbial growth. So I mean that intravenous emulsion is available in the form of, you can say, the oil. These are the oil soluble hormones, and oil soluble hormones, they're just in the form of like vitamin A, vitamin D, and vitamin K. It can be administered to the patients in the form of injection, in the form of intravenous injection, and the emulsifying oils, they are also injected as a diagnostic aids. So the emulsion should have smaller globule size. So its globule size is very small and it must be sterile, free from the microbial growth. Now come toward emulsion for external use. Now the emulsion for external application may be both oil and water type of emulsion or water and oil type of emulsion. Um, but the oil and water type of emulsion, they are preferred. So when a drug is emulsifying, so its rate of penetration through the skin may get reduced, and it helps to prolong the action of drug. So generally the emulsion for the application to the skins, they are semi-solid at room temperature and they are considered to be an excellent vehicle. So the emulsion for external use is both oil and water and oil type of emulsion. But oil and water type of emulsion, they are more preferred. For example, when the drug is just emulsified, so definitely its rates of penetrations will be high through the skin. So mean the rate of the penetration through the skin may get reduced when the drug is emulsified. So definitely its penetration rate will be ultimately reduced. So it helps to prolong the action of the drugs. So mean the drug action will be it will be for a longer period of time, and generally the emulsion for the application to the skins are semi-solid at room temperature and they are considered to be an excellent vehicle. The simple conclusion is that the liquid dosage forms, they are formulated to release the active principle immediately after oral administration to obtain the rapid and complete systemic drug absorption when it compared to the oral route. So liquid state forms, they are meant for the internal parenteral or external use. So mean that the liquid dosage forms, it can be formulated to release the active principle immediately after oral administration. Mean when they are administered orally, so after oral administration, the active principle, it may be released for the purpose of to obtain or to achieve the rapid and complete systemic drug absorption, and when it compared to the oral route. So liquid state forms mean it is for internal, for parentals, or for external use. There are some advantages of the liquid dosage form. So they are used for the patient who cannot swallow, for example, the tablets or any solid unit dosage form. And the as usually the liquid dosage form, it has fast absorption rate and it is more flexible in achieving the proper dosings. Mean you can adjust the proper dose for the patient pretty easily. And you know this is the best choice for the young children and as well as for the elders. Now, what are the different disadvantages of the liquid dosage form? So, the first drawback is it is very short shelf life due to low stability. So, you know that, and most of the liquid dosage form they are facing some stability issues. So, I think this is one of the big challenges, especially in emulsion because its shelf life is very short and it is low stability and having less accuracy. So it needs some special storage and non-spring condition. That is easily infected by the microorganism. The chances of microorganism they are high. So it is special storage required. You need some specialized containers that these emulsions can be stored over there. There are some pharmaceutical additives which are also used for the development of liquid oral. So that is vehicle, that is buffer system, that is buffers and density modified stabilizers as well as the isotonicity modifieds, viscosity enhancement. So for to increase the viscosity of the liquid dosage form. So we are using the viscosity enhancer to increase the viscosity, the internal resistance to the flow of liquid. Preservatives, they are used as and sweetening agents. They are also used. These are the pharmaceutical additives and reducing agents and antioxidants. They are used as well as the colorants. They are also used for uh, different purpose. So thank you so much for watching my lecture. Inshallah, I will continue my lecture from the liquid dosage form. So if you have any problem, any question regarding my lecture, so you can directly contact me through my email. Thank you.